Okay, I feel like I kind of rushed through the cardiac segment, so I went ahead and I'm making a recording. I've also pulled up some cool websites and images that'll help you to study. So if you see an image you want to study further, just hit pause on this recording and take your time reviewing it rather than me posting all of the links. Okay. You can also find these images yourself by going to Google Images and just typing in the name of the defect. So, types of cardiac defects. There's congenital and acquired. Congenital is there's some kind of abnormal function present at birth. Acquired is typically because of a disease process or an injury. Make sure that you do review fetal circulation. You're going to need that to understand some of the defects. So congenital heart disease, it is 5 to 8 per 1,000 live births. Typically they, at least 50 to 60% of them are symptomatic in the first year of life. Most commonly, the most common defect is your ventral septal defect, which as we get further, you'll find out is an increased pulmonary blood flow defect. And heart defects are very commonly associated with genetic anomalies such as trisomy 21 and other types of syndromes. So when you have congenital heart disease, it alters your hemodynamics, your blood concentration. So you either have an acyanotic result, meaning the absence of duskiness, so you have enough oxygen, or you have a cyanotic result, which means the body is not getting enough oxygen. To classify these defects, know that blood typically flows from a higher pressure to a lower pressure. So commonly you're going to see left to right shunt because the blood will follow the path of least resistance. Depending on the type of defect, it may be right to left shunt. Now remember, if it's a right to left, you're taking unoxygenated blood and moving it to the oxygenated side, which would circulate unoxygenated blood through the body. So, heart defects are classified as increased pulmonary blood flow, decreased pulmonary blood flow, obstruction to blood flow out of the heart, which can be either valvular or vessel-wise that's causing an obstruction, or what's called a mixed blood flow. And I do have some cool little pages here that I have pulled up. First off, when you have an infant, there are some common symptoms you're going to see, regardless of the type of defect within the heart. So you're going to see an elevated pulse, elevated respirations. This is the body's way of trying to circulate appropriately and circulate oxygen. You may see retarded growth, a failure to thrive, or slowed growth rate. They're not meeting their milestones. You'll see shortness of breath, or you'll see orthopnea. If you recall, orthopnea is difficulty breathing when lying flat. Fatigue. These babies may not want to eat, or they may not be able to finish bottles or breastfeeding. And they may have an upper respiratory infection as well. So this is just kind of a cool visual to help you visualize what is common with a congenital heart defect. Okay, so this is just another visual. I like cartoons if you can't tell. There are 35 different types of congenital heart defects, but we're not going to learn all 35. Just know that they fall into those 4 categories. Increased pulmonary blood flow, decreased pulmonary blood flow, obstructive, or a mixed defect. So one of the more common increased pulmonary blood flow is a patent ductus arteriosus, and that is where the left ventricle pumps much harder than the right. So when the ventricles contract and they're sending blood up into the pulmonary artery and the aorta, the pressure is going to be greater in the aorta than the pulmonary artery. So if there is a patent ductus arteriosus, and that is a little connection between the aorta to the pulmonary artery, you see where I'm moving my little cursor. There we go, we can enlarge it a little. It's going to send oxygenated blood into the pulmonary artery, which then sends it to the lungs. So remember washing clean clothes and your dirty laundry, you're increasing the workload on the heart unnecessary. So then coming over here, we have what's known as a decreased pulmonary blood flow. Oh, going back, other things that can cause increased pulmonary blood flow would be an atrial septal defect or a ventricle septal defect. So going back over to decreased pulmonary blood flow, we have Tetralogy of Follow is the most common defect that you'll see this. And what happens here, for whatever reason, we now have a right to left shift, which means we're going to shift unoxygenated blood to the left side of the heart and circulate that, which will cause the baby to appear cyanotic. In the event of a tetralogy fit, when the baby becomes upset, that right-sided pressure increases much more, causing an even greater shift of unoxygenated blood to circulate through the body. And I also have an image of this. If you have somebody who has decreased pulmonary blood flow, such as the Tetralogy of Follow, you're going to see squatting, cyanosis, clubbing of the fingers, which indicates chronic low oxygenation or chronic hypoxia, and syncope, dizziness. And then I have an image of a Tetralogy of Follow. Let me see if I can enlarge that for you. There we go. Okay, so here we have, this is what a normal heart looks like. So we have unoxygenated blood in the right atria, goes to the right ventricle, it goes up through the pulmonary artery. And then from the pulmonary, it comes back through the pulmonary vein, right here, and it's done into the left atria, left ventricle, up through the aortic aorta, okay? And here you can see this one is closed, this ductus arteriosus. Now let's come over, and our baby has Tetralogy of Follow. And Tetralogy of Follow, you're going to see a grouping of abnormal defects. So first off, we see narrowing or stenosing of the pulmonary artery. So this is going to increase pressure on the right side because it can no longer easily send blood up into the pulmonary artery. Then you'll see we have a septal defect. It's a very large septal defect, and it actually opens into the left ventricle as well as into the aorta. So as you're seeing, the unoxygenated blood is coming in from the vena cava into that right ventricle, and it's needing pressure to go to the lungs, and it's contracting and sending unoxygenated blood up into the aorta. Now, another thing I want you to notice is this is called a hypoplastic left heart. It is not as muscular, nor is it as large as the normal heart. See the difference in the size of the ventricles here? So that is allowing that pressure to be greater on the right than on the left. Okay? So when this baby gets upset and the heart's pumping harder, this is going to get even more pressurized, creating a much more cyanotic event, otherwise known as the tet fit. Okay? So, then we have what's called the obstructive defect, and this is where blood is either not flowing through or it is greatly restricted. And the example for that is called a coarctation of the aorta. And I also have a picture of that as Well, see, here it is, and let me make it bigger. There we go. All right. So normal looking heart, we come up into the aorta, we're going along, we're breaking off in our feeders, and lo and behold, we hit a huge traffic jam. Okay? So what this does is it now increases that pressure, okay, backing up into the heart. And then we're going to back up into the pulmonary veins. And from there, we're backing up into the lungs, which is going to make the lungs sound wet, okay? Now, if we had a patent ductus arteriosus, okay, we would be increasing pulmonary blood flow, okay? But we don't at this time. But one of the treatments would be to do a bypass here, or to create a patent ductus arteriosus there. Okay, so this is an obstructive defect, and depending on where the coarctation is, blood pressures will be different in the extremities. So these two branched arteries will supply blood and oxygenation and pressure to your upper extremities. Now we've reduced blood flow to the lower thoracic aorta, which means we are also decreasing pressure to our extremities. So if we took a blood pressure on a right upper arm and a right lower arm, we would expect much higher pressure on the upper extremity. And oftentimes school-age children and middle school-age children, this is when coarctations that are mild are caught, because they do this blood pressure check in both extremities. So that is coarctation of the aorta. Okay, moving on back there. Oh, if you have increased pulmonary blood flow, such as the patent ductus arteriosus, septal defects, the child's not blue. They're just going to be tired. They may have a heart murmur. They may have slow development, but they're not blue because they're getting more than enough oxygenated blood. Okay. And then a mixed lesion or mixed cardiac defects is there are multiple problems here, and oftentimes one heart defect is a blessing when you have another type of defect. And so let me see if I got a picture of this. There we go. This is called a transposition of the great arteries, and essentially what's happened is the pulmonary artery and the aorta have been flipped. And so we are circulating oxygenated blood through the left side. Hang on one second. So essentially, the right side of the heart is sending oxygenated blood to the lungs, and the left side of the heart is sending unoxygenated blood out into the body. So you can see how that would not set the newborn up for survival. But fortunately, there seems to also be a grouping of congenital heart defects that go along with the transposition of the great arteries that allow them to survive. So you'll see here we have a patent ductus arteriosus, so that allows for mixing of the blood. We also have a very large atrial septal defect, which also allows for the mixing of the blood. And commonly, you'll see they have a hypoplastic left heart, which you can kind of see looking at the picture. The ventricle is not quite as large as it should be, which decreases that left to right pressure, and so it allows for the mixing of oxygenated and unoxygenated blood. So those are the four major types of heart defects that you want to be aware and familiar with nursing interventions. Like I said, you want to look at those cute little ones here. For decreased pulmonary blood flow, you want them to squat. Pull the knees to the chest, and it increases that pulmonary blood flow.